right, good evening, folks. Welcome to Super Points. Today we are going to do another episode on preventive and social medicine. Very, very important for your NEET exam. And we pulled last 20 years previous year questions. Okay, our AI program, it pulled the most important things from the last 20 years. So follow these questions closely. You will definitely get some of these questions in your own exam. First, let us see some important points. Because too often we memorize things without understanding the concepts. It's very important we understand the concepts. So first we will understand the concepts, then we will go to answer the MCQs. So today I want to spend some time on pre-service and other stuff related to IMN CI. So what is pre-service IMN CI? First of all, to follow closely, download this file. It is available. I gave there as a link. So download that link so that you can actually read the same document I am reading here. What is the importance of pre-service IMN CI? Pre-service IMN CI helps scale up IMN CI by including it in the curriculum of medical colleges. What is the main objective of pre-service IMN CI? The objective is to provide trained IMN CI manpower in public and private sectors. Then we have facility-based IMN CI. What is FIMNCI? FIMNCI is the integration of facility-based care package with IMNCI package. What is the aim of FIMNCI? It aims to empower health personnel to manage newborn and childhood illnesses. Remember that. The whole thing is IMNCI is integrated management of neonatal and childhood illnesses. So this is about newborns and childhood illnesses. Next, which major conditions are targeted under FIMNCI? It targets asphyxia, sepsis, low birth weight, pneumonia, diarrhea, malaria, meningitis, and severe malnutrition. Who are the master trainers in IMNCI? So the master trainers are pediatricians from tertiary hospitals and medical colleges. They act as master trainers. Next, facility-based newborn care. What is the priority in facility-based newborn care? The priority is care of sick newborns and children referred from peripheral centers. Next, why are SNCUs important? SNCUs, special newborn care units, why are they important? The name says it all, right? So they provide specialized newborn care for sick neonates. Where are stabilization units established? Stabilization units are established at CHCs, community health centers. Where are newborn care corners established? Newborn care corners are established at all delivery points. Okay, wherever you are delivering babies, you should have newborn care corner. So what is newborn care corner? So it's a space within delivery room for immediate newborn care. Is NBCC mandatory in delivery facilities? Yes, NBCC is mandatory in all health facilities conducting deliveries. Approximately how many are operational in India? Approximately 22,147 are operational. Next, newborn stabilization unit, NBSU. NBSU, what is the function of NBSU? NBSU provides care for sick and low birth weight newborns. Where is NBSU located? It is located within or near the maternity ward. How many beds are needed in NBSU? NBSU requires 4 beds and 2 postnatal beds for rooming in. Approximately how many NBSUs? We have like 3,215 NBSUs in India. Next, Special Newborn Care Unit, SNCU. What is SNCU? SNCU is a neonatal unit providing special care except assisted ventilation and major surgery. Which hospitals should have SNCUs? Facilities conducting more than 3,000 deliveries. Okay, that's a question. More than 3,000 deliveries, you should have an SNCU. And what is the minimum recommended bed strength? Minimum recommended bed strength is 12 beds. How are additional SNCU beds calculated? 4 additional beds are added for every 1,000 deliveries. For example, if you are having more than 4,000, then 12 plus 4, you should have like 16 beds. So approximately how many SNCUs are functional in India? 979. Next, triage of sick newborns. What is triage of sick newborns? It is rapid screening of neonates for prioritizing management. Which respiratory rate indicates severe respiratory distress in newborns? So if you see a respiratory rate more than 70 per minute, that means severe distress. That baby should go to SNCU. Then hypothermia. What temperature indicates hypothermia? Temperature below 35.4 indicates hypothermia. So if they give you a baby below 35.4, that baby should go to SNCU. What temperature indicates hyperthermia in newborns? Temperature above 37.5 indicates hyperthermia. Alright, if the baby has temperature is more than 37.5, SNCU. What capillary filling time indicates a shock in newborns? Capillary filling time greater than 3 seconds indicates shock. Alright, so any of those can come as a question. Next, criteria for admission to SNCU. Which low birth weight newborn should be admitted to SNCU? Newborn weighing less than 1800 grams should go to SNCU. Which gestational age requires SNCU admission? Gestational age less than 34 weeks require admission. Which type of jaundice requires SNCU admission? Severe jaundice involving palms and soles requires admission. Which feeding problem indicates SNCU admission? Refusal to feed indicates SNCU admission. Next, criteria for transfer from SNCU to step-down unit. When can a newborn with respiratory distress be transferred from SNCU? Whenever respiratory distress improves and oxygen is no longer needed. Which low birth weight babies can be transferred to step-down unit? Stable low birth weight babies with adequate weight gain can be transferred. Next, criteria for discharge from SNCU. What temperature related criterion is needed for SNCU discharge? The newborn should maintain temperature without radiant warmer. What feeding criterion is needed for SNCU discharge? The newborn should accept breastfeeding well. What weight criterion is needed for SNCU discharge? The newborn should gain weight for 3 consecutive days and weigh more than 1.5 kilograms. Next, home-based newborn care. What is the main objective of home-based newborn care? HBNC aims to decrease neonatal mortality and morbidity. Who is the main worker involved? Asha is the main worker involved in HBNC. So she should do the visits. Next, what are the major goals of HBNC? Essential newborn care, early illness detection, referral, and healthy practices promotion. Which babies receive special attention under HBNC? Preterm babies and low birth weight newborns receive special attention. Next, responsibilities of ASHA in HbA1c. What is the role of ASHA in antenatal care under HbA1c? ASHA mobilizes pregnant women for full antenatal care. And what is the role of ASHA in breastfeeding support? ASHA teaches positioning, attachment, and exclusive breastfeeding. What hygienic practices are promoted by ASHA? Hand washing, skin care, cord care, and eye care. Next, what danger signs should ASHA identify early in newborns? Sepsis should be identified early. Next, what counseling is provided by ASHA under HbA1c? ASHA provides counseling on family planning and newborn care. Next, HbA1c home visits. How many visits are made after institutional delivery under HbA1c? 6 visits. All right. If it is institutional delivery, 6 visits. If it is home delivery, 7 visits. You need to remember that. So 6 visits on days 3, 7, 14, 21, 28 and 42 days. And 7 visits, just add 1 at the beginning. All right. So you get 7 visits. What incentive is given to ASHA after cesarean delivery follow-up? ASHA receives Rs 250 after completing days from 7 to 42. What incentive is given for follow-up of SNCU discharged newborns? All right. ASHA receives 250 for remaining visits and 50 monthly follow-up incentive. What incentive is given in twin deliveries under HbA1c? Twins double, 250 double, so 500. All right. If it is a triplet deliveries, they are getting 750. Next, home-based care for young child. So HbYC. HbYC is an extension of HbA1c for young children. Which domains are covered under HbYC? Nutrition, health, childhood development, and WASH are covered. At which months are HbYC home visits conducted? So visits are conducted 3, 6, 9, 12, 15 months. So let's just add 3 months. 3, 6, 9, 12, 15. Next, what feeding practices are promoted under HbYC? Exclusive breastfeeding till 6 months and continued breastfeeding till 2 years are promoted. What incentive is given to ASHA under HbYC? ASHA receives Rs 250 for completing 5 visits. Next, NSSK, Navjat Sishu Suraksha Karyakram. What is it? It is to train health personnel in newborn care and resuscitation. Why was NSSK launched? It was launched to address care at birth. What are objectives of NSSK? Prevention of hypothermia, infection, early breastfeeding, and newborn resuscitation. Next, IMNCI. What is IMNCI? IMNCI is an integrated strategy for management of neonatal and childhood illnesses. Why is IMNCI necessary? Many children present with overlapping symptoms requiring integrated management. Which diseases are mainly targeted under IMNCI? Diarrhea, ARI, malaria, measles, malnutrition. What is the age group newly included in Indian IMNCI? Neonates aged 0 to 7 days are included in Indian IMNCI. What is the major feature of IMNCI training? Training is skill based. Next, RBSK, very important for your exam. Rashtriya Bal Swasthya Karyakram. So when was RBSK launched? February 2013. Okay, so RMNCH plus A, it was also launched same year, same month. All right, remember that. So what does RBSK focus on? RBSK focus on early detection and management of 4Ds. What are the 4Ds under RBSK? They are defects at birth, diseases, deficiencies, developmental delays. Which age group is covered under RBSK? Ages 0 to 18 years are covered. Which teams conduct school screening under RBSK? Dedicated mobile health teams conduct screening. How many conditions are screened under RBSK? 30 health conditions. Okay, that can come as an MCQ. RBSK covers 30 conditions under those 4 Ds: defects, deficiencies, diseases, and developmental problems. Next, RMNCH plus A strategy. What does RMNCH plus A strategy stands for? Reproductive, maternal, newborn, child, adolescent health strategy. When was RMNCH plus A launched in India? It's February 2013. What is the focus of RMNCH plus A strategy? It provides comprehensive care across reproductive, maternal, newborn, child, and adolescent health. Which additional life stage is included in RMNCH plus A? Adolescence is included. What are the guiding principles of RMNCH plus A? Equity, universal care, entitlement, and accountability. All right, folks. So that is the quick recap of the most important things. Now, with those things in your mind, let us answer these MCQs. All right. I gave that file. So download the file and you can actually answer as I answer, so that we can do it together. You can do it again and again, so that you are very good in answering these questions. So pre-service IMNCI has been included mainly in. So pre-service IMNCI, the government of India wants all of us to know the basics. So where do they want it? B, medical school curriculum. Correct answer. Okay. So facility-based IMNCI mainly focuses on management of. So facility-based, what is this all about? The name tells everything, right? Integrated management of neonatal and childhood illnesses. So the answer is C. So to answer this question, all you need to know is what is IMNCI? What is the expansion of that? What are those alphabet represent? Then you will answer that question. Which of the following is not targeted under FIMNCI? Is pneumonia targeted? Yes. Diarrhea targeted, malaria targeted. So correct answer is D. NBCC stands for. So all these mnemonics, like you get so many mnemonics, and you need to know what do they stand for. All right, NBCC. So NBCC stands for Newborn Care Corner. That is the answer. C is the correct answer. So NBCC is mandatory. It is mandatory in all delivery facilities. Wherever you are delivering babies, you should have NBCC. NBSU is mainly provides care for. So why do you want NBSU? You want it for sick and low birth weight newborns. Next, SNCU provides all except. So it provides special newborn care because that is the name of it. It takes care of sick newborns, yes. It provides stabilization services, yes. But it does not provide assisted ventilation. It does not provide any surgeries. All right. So the correct answer is B. Next, which newborn should be admitted? All right. Who should be admitted? Definitely not healthy one. Definitely good weight babies. Definitely not mild jaundice. So who should be admitted? Weight less than 1800 grams. NSSK is mainly related to NSSK, Navjat Shish Suraksha Karyakram. So this is about, the name says it's right. It's about newborn. So it's a newborn resuscitation. Indian IMNCA additionally includes, so Indians we have added this one, 0 to 7 days. RBSK focuses on early detection of 4 Ds, right? RBSK is 4 Ds like defects and deficiencies and diseases and developmental delays. All right, so these 4 are covered under RBSK. Next, which of the following is included under 4 Ds? So it's just the previous one. defects are included. So diabetes not included, dengue not included, drug abuse not included. So correct answer is A. RMNCHA added which stage as a distinct life stage? So it added A for adolescence. So B is the correct answer. Which program aims at integrated management of neonatal and childhood illnesses? So which program aims? All right, so it is correct answer is this one, IMNCI. The name says it all. Which program focuses on the 4Ds? As I said, RBSK focuses on that. Home visits to newborns under HBNC are mainly conducted by, they are conducted by ASHA. All right, ASHA should go. Newborn care corner is located in delivery room. B is the correct answer. Which unit provides specialized newborn care in district hospitals? That is SNCU provides specialized care. Next, master the numbers. All right, so a lot of numbers, like just go through these tables. It's easy to remember and to review, especially when you don't have much time. It is very good to go through these numbers tables so that you can review these numbers quickly. For example, 12 beds, that is the minimum recommended beds in SNCU. What is the basic NBSU bed strength? It is 4 beds. What is the criterion for establishing SNCU? That is 3,000. If you have more than 3,000 deliveries per year, then you should have an SNCU. What is hypothermia in a newborn? It is less than 35.4 degrees Celsius. What is hyperthermia in a newborn? It is more than 37.5 degrees Celsius. What is severe neonatal respiratory distress? It is more than 70 per minute. What is the capillary filling time indicating shock? It is more than 3 seconds. What is the admission criterion to SNCU? It is less than 1800 grams. What is the gestational criterion for SNCU admission? It is less than 34 weeks. What is the weight criterion for SNCU discharge? When can you discharge? When the baby weighs more than 1.5 kilograms. All right. Next, HNBC visits after institutional delivery. After institutional delivery, you should have 6 visits. After home delivery, you should have 7 visits. And what are the days after institutional delivery? Day 3, 7, 14, 21, 28, 42. After home delivery, it is 1, 3, 7, 14, 21, 28, 42. Then ASHA incentive after cesarean follow-up is 250 rupees. Then in twins, 500. In triplets, it is 750. Additional age group included in IMNCI 0 to 7 days. Launch of RBSK, it was February 2013. Age group covered under RBSK 0 to 18 years. How many conditions screened under RBSK? 30 conditions. Core concept of RBSK is 4 days. And HBYC, that is for home-based youth. All right, so young children, that is young children program, and that is for 3, 6, 9, 12, 15. So add 3 months, 3, 6, 9, 12, 15 months. So with those numbers in mind, let us answer these questions. Rashtriya Bal Swasthya Karyakramam was launched in 2013. RBSK covers which age group? It covers 0 to 18 years. Then hypothermia in neonates is defined as less than 35.4. Under HBNC, ASHA visits institutional delivery newborns up to, so you have to go up to 42 days. Number of HBNC visits after institutional delivery. After institutional delivery, you have to give 6 visits. HBYC home visits are conducted at B, 3, 6, 9, 12, 18, 15 months. Minimum recommended bed strength of SNCU. Minimum you should have 12 beds. SNCU should preferably be established in facilities conducting more than C 3000 deliveries per year. RBSK covers children up to which age group? Up to 18 years. How many conditions are screened under RBSK? You screen 30. Asha receives what incentive amount in twin deliveries? So they are asking about twins. So 250 to 2 times, that is 500 rupees. Severe respiratory distress, a newborn is indicated by respiratory rate more than 70 per minute. Correct answer C. Next, let us do an RMNCH plus A. That was launched in 2013. A stands for, so A stands for adolescent. RMNCH plus A became the heart of B, National Health Mission. RMNCH plus A follows which approach? It follows continuum of care approach. All right, it follows because you're starting with babies, right? Then these babies are becoming infants, and infants are becoming children. Children are becoming adolescents. Adolescents are becoming young people, and young people are becoming parents, and then they are having she's becoming a pregnant, and then she's giving birth. So it's like a nice circle of care. All right, that's why it's a continuum of care approach. Number of high priority districts. High priority districts number 184. All right, which system is used for tracking mothers and children? The name says it's all MCTS. All right. So don't fall for Matru Shishu system. All right, it is MCTS. Which contraceptive method is specially promoted under RMNCH plus A? It is PPIUCD. Which drug is distributed in villages with high home deliveries? You distribute misoprostol. All right, so they're having lots of home deliveries, and there is the problem of postpartum hemorrhage. You want to stop that. That's why you are distributing misoprostol. Which facility provides intensive newborn care? Intensive SNCU. Which program screens children for the 4Ds? 4Ds, it is RBSK, D. The 4Ds under RBSK include, what are these 4Ds? They are defects, diseases, deficiencies, development. So the correct answer is C. Which combination is recommended for diarrhea management? So you are dealing diarrhea, so definitely you need ORS, but ORS plus zinc. So that is the correct answer, D. Which clinic is established for adolescents? For adolescents, it is ARSH clinic, that is C. All right, don't confuse with D, DRSH clinic. It is ARSH clinic. YIFS program provides B, weekly iron and folic acid. Which antihelminthic drug is used in WIFS? It is albendazole. You give albendazole for deworming. Which act is implemented during pregnancy care interventions? This is PCPNDT Act. Which facilities mainly provide skilled birth attendance? Skilled birth attendance come from this one, D. What does the N in RMNCH plus A plus N stand for? So this N, what is it for? So they give you different N's to confuse you. The correct answer is D. It stands for nutrition. Which program includes adolescence as a distinct life stage? That is A. Next, which program provides weekly iron supplements to adolescents? That is WIFS, C. Which intervention is included under child health in RMNCH plus A? Intervention is D, ORS plus zinc. So RMNCH, there are some important numbers even here. So this master the numbers table. Use this table to quickly go through important numbers. So it was launched in 2013. High priority districts are 184, and target IMR by 2017 is 25 by 1000 live births. Target MMR is 100 by 100,000 live births. Target TFR by 2017 is 2.1. Pregnancies developing complications 15%. Then minimum deliveries at L1 facility 3 per month, L2 facility 10 per month, L3 facility 20 to 50 per month, and transport target time. That means like once somebody calls, a pregnant woman calls for transport, like you need to provide it in 30 minutes. Next, elemental iron in WIFS 100 milligrams, folic acid in WIFS 500 micrograms, then albendazole dose 400 milligrams. Age group under menstrual hygiene scheme. So for girl adolescents, you provide up to 10 to 19 years. Next, bed strength of MCH wings 30, 50, 100 beds. So with those numbers in your mind, let us answer these questions. RMNCH plus A was launched 2013. Next, number of high priority districts 184. The target IMR under RMNCH plus A target is 25 live births. Okay, so they confuse you, 25 per thousand total population. Okay, you can get confused, but it is not for total population, it is live births. The target MMR under RMNCH plus A, so here it is 100 live births. Okay, it's not 100 by 100 population. Okay, C is the correct answer. Target fertility rate 2.1 A. Weekly elemental iron supplementation under WIFS is 100 milligrams. Weekly folic acid is 500 micrograms. So folic acid and 500, F for F. That is how I remembered it. Albendazole dose WFIS is 400 mg. Which age group is covered under menstrual hygiene scheme? 10 to 19 years, D. Minimum deliveries required at L2 facilities. So 3 for L1, 10 for L2. Alright, so C is the correct answer. Alright folks, those are the most important things from the previous years. So go through this document, like go through our link, and you can answer these questions again and again, so that you will become very good, and definitely you will get some questions. So prepare well for your examination. Visit our website www.superpoints.ai, where you can practice thousands and thousands of questions as you prepare for your NEET-PG. Thank you, and I will see you in the next episode.